CTV family, catch us live on your TV screens.
Good day, everyone. My name is Dr. Tlaleng Mofokeng, and I'm coming to you from Johannesburg in South Africa. Now, most people just call me Dr. T for short, and that's perfectly fine. I am speaking to you in my capacity as the United Nations Special Rapporteur on the right to health. Now, the AIDS and Rights Alliance for Southern Africa is launching this important report at a very challenging time, and the campaign is on the right to bodily autonomy and integrity. Now, this campaign is focused on 4 key interventional areas, and as a clinician and a doctor myself, I think it's very important to highlight these 4 interventional areas. Firstly, the area of HIV prevention, the rights of LGBTI persons, access to safe abortion, and the integration of SRHR into universal healthcare coverage conversations. It is important to consider the need to address the pervasive gender inequality as a cross-cutting issue that affects everyone's right to realize the best outcomes in terms of health. Now, the right of everyone to the enjoyment of the highest attainable standard of physical and mental health well-being is related to many other important human rights. It's interlinked, it cannot be divorced, they are non-negotiable, and all of us who are working in the human rights field should be drawing on international human rights law and standards, and of course drawing heavily from the Universal Declaration of Human Rights, the Commission to End Discrimination Against Women,
Thank you so much, Dr. T, for those insightful words. We're learning a lot today, and you're welcome to ask questions as well, 074-650-0202. But before you ask a question, we have a question for you. How do you celebrate your body? How do you ensure that you are comfortable in the body that you're currently living in? Or are you looking to do a couple of improvements here and there? How do you go about doing that? And
how do you own your body?
How do you own your body? We're giving away 5 T-shirts to you and yours. If you give us that answer, I'm sure they're all going to be favorable, so don't be shy. There's no wrong answer. 074 once again, 650-0202. Or can you hop onto our social media handles on Facebook, Ekse Live, Twitter and Instagram, go Ekse_Live. This is hashtag Talk Thursday.
Talk Thursday, and we're still talking about body autonomy as well as integrity. Still, the people from Arasa are with us today, and they're going to be diving into the conversation of what it is to be, or rather, what is bodily autonomy. So first and foremost, I love the conversation you guys are having, because we're really understanding what is bodily autonomy. Now that we understand it, and we understand it based on women, or rather women living with HIV, now we want to find out, how does bodily autonomy work when it comes to queer people, or rather the LGBTI plus community?
I think whether you're queer or whether you're straight, you have the same fundamental rights.
Yes.
But I think it would be hard to disagree with the fact that we live in a society that still discriminates upon people who are lesbian or gay or transgender people who need specific type of healthcare. And what bodily autonomy and integrity means when you're queer, when you're part of when you have a different sexual orientation or gender identity than the majority of this country, is the fact is that we need to be free of stigma. We need to be able to express ourselves without the fear of being discriminated, without the fear of being shouted at, without the fear of even physical violence. But it goes even deeper. It's about feeling comfortable with who you are. And while it's easy to say you should feel comfortable with how you express yourself and who you are, we need to acknowledge that we live in a society where what you say will impact someone else. So even if you're not queer, right, there's some things that you're saying and the way you're acting and the way you might be gossiping about somebody who is queer or might be using certain words, they can have an impact about how queer people feel. And that might have an impact about how they make decisions about their body, their life, or their health.
There are a couple of people that wake up in the morning and they don't believe that this body belongs to them. They feel trapped, like I do not belong, I hate my body. Is there something that Arasa does for that kind of a person?
Yeah, so we have various programs and campaigns. This is our main campaign, but we also have a training program, which we call TALP, Training and Leadership Program, which we run on an annual basis, and it's open to any young person in the region, but mainly Arasa partners within the 18 countries in Southern and East Africa. But there's various platforms. We have various resources online. We have toolkits. We have online training. But it's not only Arasa, it's beyond that. Our partners within Southern East Africa, if you want to have questions, go to your, clinics is supposed to be able to assist you, hopefully, and that we also train healthcare professionals, law enforcement officers, but just the normal person on the ground, you know. It is a very strange topic, you know, for people, you know. We're not socialized in a way where we are even able to speak about our body, you know, let alone if our bodies are differently defined, or we want to do different things with our body, you know, and we want to dress differently according to how we were raised or the expectations from society. But for me, I think the main thing is these conversations need to start at home. It needs to start at home. We need to create safe spaces for our young girls, for the young women, for our young boys to be able to feel free and safe to say what is happening to my body. We need to create safe spaces within the home space to talk about sex, to talk about safe sex, to talk about HIV. If you look at the stigma of COVID at the moment, people are the same it was done for HIV. If I do not identify with my body and how it needs to perform and what society is expecting of me, we don't talk about that. I can't go to my parents, you know, I can't even go to my parents about menstruation or contraceptive or what would be good for my body, you know. So we need to unpack that, and it needs to start within the home. So we have a multi-pronged approach where we work with diverse group of people, young people, older people, politicians, policymakers, healthcare professionals, law enforcement, and I think most importantly, religious leaders. So that's our focus, because we know we go to school, we go to, on a Sunday we go to church, and there's a message, and we come home and we believe that's what he said. And so we make sure that we conscientize a diverse group of people for it to get to young people.
Thank goodness for that, and today you made it all possible for millions of viewers that are watching Ekse right now.
Definitely. And I think an important thing that you mentioned was the health professionals and people that are in law enforcement, because these are public servants, you know, these are people that provide public services to the people and the citizens. So what is then, because I feel a lot of people, we've read articles and stories about people going to a clinic, for example, and they go in there for an abortion, and they feel discriminated against by the nurses. When you go to the police station, you're offering for help, you know, and maybe because you're someone of a queer body, you feel as if you are not getting adequate rights, in which then directly impacts your human rights as a human. How important is it then to also bring those conversations in those workspaces, especially with people that deal with citizens on a day-to-day basis?
Right, so we live in a very patriarchal society, right? And this is where we're socialized, including healthcare professionals. So you'd find in Cape Town that the same nurse who is supposed to provide access to services to anybody, they follow because of their own socialization and narrow-minded kind of view of that there's only male and female, and that you're supposed to be in a certain way according to your sex. So you get to the clinic, and and South Africa has one of the most beautiful constitutions and laws and policies in place that really protects us, that really protects our bodies and our human rights. And so when you go to the clinic, that nurse, instead of following the policies and the law and what they're supposed to do in terms of delivering a service, they rather follow a very moralistic approach to say, oh no, why are you coming here to come and find contraceptives in school clothes? And so you will be too scared because that same person lives in your community. So there's so much stigma and discrimination. But 9 months after that, you come there pregnant. And the same healthcare professional is saying, why are you pregnant?
Wearing school clothes.
Exactly.
Because it didn't give me contraceptives. Wearing my school clothes. What are you talking about? Ladies and gentlemen, welcome to it. If you just joined us, well, Sikon and go YouTube as Ekse Live. Otherwise, you can catch the repeat in the morning between 8 and 9. Worry not, because there's still more conversation right here on Ekse Live with Arasa on the flip side of this. So don't go anywhere, because we are not. All right?
CTV family.